my name is Anakin and I'm going to be talking about why art therapy should be covered by insurance. So, what is art therapy? Art therapy is an integrative mental health and human service profession that enriches the lives of individuals, families, and communities through active art making, creative process, and applied psychological theory and human experience within the psychotherapeutic relationship. Art therapy is a form of expressive therapy that uses the creative process of making art to improve a person's physical, mental, and emotional well-being. The creative process involved is expressing oneself artistically can help people resolve issues deep within themselves and help to develop and manage their emotions, behaviors, and feelings, reduce their stress, and improve their self-esteem overall. So, who teaches this art therapy? Well, art therapy is provided by a professional art therapist. This therapist effectively supports personal and relational treatment goals to make sure that you get the treatment that you need. Art therapists are master level clinicians who work with people of all ages across a broad spectrum of practice. They use ethical standards, and their education and supervised training allows them to work with people of all ages in all different settings. Art therapists have been seen to be working in hospitals, schools, veteran clinics, private practices, psychiatric rehabilitation centers, community clinics, crisis centers, and even senior community centers. So why is art therapy useful? Well, art therapy is used to improve cognitive and sensory-motor functions. It helps foster self-esteem and self-awareness, cultivate emotional resilience, promote insight, and enhance social skills within oneself. It also can help resolve conflicts and distress and advance societal and ecological change within the individual. Art therapy can affect different things for different people. It is used for counseling by therapists, healing treatment, rehabilitation, psychotherapy. In other words, it's used to help heal one's inner self and help keep a better understanding of one's feelings and how they manage those in society. So why does this work? Well, art therapy is a form of expressive therapy that uses art materials such as like chalk, paint, or markers. Art therapy combines traditional psychotherapy theories and techniques, but it also has an understanding of the psychological aspects of the creative process of the mind. It's especially effective properties of the different art materials. Art therapists are trained in both art and therapy. They are knowledgeable about the human development, psychological theories, and clinical practice. They even have training in spiritual and multicultural and artistic traditions. The healing potential of art, they use the art treatment, assessment, and research, provides the necessary consultation for other allied professionals within. It also helps with integrative methods. Art therapy engages the mind, the body, and the spirit in ways that traditional therapy can't, and it's distinct from verbal articulation alone. Like any therapy, there's always the cons. So the cons of art therapy is it can be quite expensive. Art therapy, like any other, is a therapy nonetheless, and a person can do it for days, weeks, months, or even years. It just kind of depends on the person and what they're using it for. It can range anywhere between $40 to $260 each visit. There are very few places in the world or at least in America, that still generally practice therapeutic art therapy. Some places don't have properly trained professionals conduct such therapy, therefore not doing what needs to be done correctly. According to the American Art Association in 2018, there was 14 case studies done about how in facilities that conduct such art therapies that consider themselves to be therapists aren't actually trained professionals, therefore don't have the experience or the training needed to be successful in this art therapy. Another factor in the cons of why art therapy might not work and why insurance may not provide for it is because many people aren't being open to being creative and expressive, where in today's society they'd rather just sit in their phone or in their room alone and not talk about their feelings. And I can see why insurance would not want to pay for something that they're not going to get a use out of.